8:15, Thursday, October 15th. I'm Tommy Tucker, and that October 15th is important because Medicare's annual enrollment period starts today. So what does it mean for you if you have Medicare? It's the time to review your current coverage and decide if you want to make any changes for 2021. There's a lot to consider, and Dr. Brent Wallis from People's Health, our friend Dr. B, joins us now to discuss 8 important things to know about Medicare. These 8 things will help you better understand the benefits that are available to you, whether you're already enrolled in Medicare or will be eligible soon. Morning, Dr. B. How are you?
Hey, Tommy. I'm doing great.
I think it's kind of complicated, so let's jump right in. The 4 parts of Medicare are what?
Yeah, it's kind of like an alphabet soup. It's parts A, B, C, and D. And the way we break it up is Part A typically covers inpatient hospital stays. Part B is medical insurance, so that covers outpatient things like doctor's visits and preventative services, things like that. Part D is the prescription drug plan, so that covers all of your medications. And Part D is something that's separate, that's sometimes included with other plans. And then the last one is Part C. Part C is Medicare Advantage plans, like People's Health. Those are plans that are offered by private companies that actually work with Medicare to provide those benefits to people. And that's what you're eligible to start enrolling in on October 15th.
So, like, what kind of out-of-pocket costs are you looking at with Medicare? Is the whole thing free?
No, a lot of people don't realize this, but original Medicare, so under Part B, which, remember, covers the outpatient services, usually people have a percentage of responsibility. So usually it's 20% of the cost. So if you go to see your doctor and it costs $100, then Medicare will pay for $80 and you're responsible for the other $20. And the other issue with original Medicare is that those out-of-pocket costs don't have a limit, so they can really add up if you have a lot of doctors or a lot of preventative services that you're trying to access. And then with Part A, typically that's the hospital side, and that usually you'll pay a deductible, and then you also pay daily copays. So if you need to go into the hospital, that can get very expensive because it can add up if you have a longer stay. So the benefits of something like a Medicare Advantage plan like People's is that you have a limit on your out-of-pocket costs. So when you hit that limit, you don't pay any more. So it allows you to budget a little bit better, especially if you have chronic medical problems you know you're going to need to seek care for.
Benefits that Medicare doesn't cover, what are they?
Yeah, Medicare, covers medical services. So original Medicare is pretty much doctors and hospitals. They do, like I mentioned, require you to have a Part D plan as well to cover your medications. What it doesn't cover, though, is routine services, things like dental cleanings, vision exams. A lot of those can be added within a Medicare Advantage plan, which is why those plans are a little bit more comprehensive care. The other thing that Medicare Advantage has typically is a fitness benefit, and so that means you can go to the gym and not have to pay extra for it, and original Medicare doesn't pay any of that for you.
Let me take a break. Let me let my eyes deglaze, Doc. You're doing a great job explaining it, but this is kind of complicated, and we'll pick it up. Maybe we'll talk about a little bit more about Medicare Advantage plans when we come back. Dr. B is our guest, Dr. Brent Wallis, Chief Medical Officer of People's Health. We're talking senior health as we do. Today, though, is the first day of open enrollment. Medicare's annual enrollment period starts today, and if you've had a parent that, or maybe a person that's involved with this for the first time, you have a parent that's involved with it, or you are involved with it, hang on because we'll give you the details you need. It's 8:20. That's time for traffic now on WWL. Tommy Tucker, WWL, Thursday, October 15th. In about 4.5 minutes, Dave Cohen's going to be here, and he's going to have some details for you about New Orleans maybe moving into Phase 3.2. We expect to find out today. And your blood type may play a role if you catch COVID. Dr. Brent Wallis is our guest, Chief Medical Officer of People's Health. We're talking about Medicare enrollment. Today is the first day of that. And, Doc, we're picking it up here, I guess, with maybe a little bit more detail about Medicare Advantage plans.
Yeah, sure. So to join a Medicare Advantage plan, you have to have Medicare's Part A and B. But when you sign up for Medicare Advantage, those benefits are actually administered through the company that you sign up with. And you get those additional benefits we were talking about, like dental, vision, health club memberships, and occasionally even an over-the-counter benefit where you can get medications from a pharmacy, medications and supplies from a pharmacy. So there's a lot of advantages to it, hence the name. So you might have to pay a monthly premium for Medicare Advantage plans, but there are many plans that are available, like People's Health, that have premiums as low as $0. So you don't have any additional out-of-pocket. Now, you do have to continue paying your Part B premiums. So everyone does have to pay a premium for Part B when they have it.
Yeah, I never realized that. I guess that is why they do call it Medicare Advantage, huh? Speaking of cost, how can you lower some Medicare expenses?
So there's a couple of things you can do. So anyone who qualifies for Medicaid or any form of state assistance might qualify for something called a SNP plan or a special needs plan. And those plans typically have lower cost for all of their services, so their copays are either lower or maybe even $0. So that's something that you definitely want to look into to save you some money in your budget.
I get a text here about extra help. What is extra help?
Yeah, so Extra Help is another program that not everyone knows about through Medicare that can actually help you pay the cost of your prescription drugs. And it's not full Medicaid, but it's administered through the Social Security Administration, and it could save people up to $4,000 a year if you're eligible. So it's real important to contact the Social Security Administration and see if you might qualify for that extra help, because it can really help you in your expenses throughout the year.
So can you apply for that through the Social Security Administration or not?
You can, and your health plan too. So if you go with a Medicare Advantage plan, they can give you some more information about that as well.
When can you enroll?
So today is the big kickoff, like you mentioned. October 15th is the first day that you can start shopping plans and start enrolling in them. Typically, they won't be effective until the 1st of January, except for those special needs plans, which sometimes can be effective a little bit sooner. And that goes all the way through December 7th. So you've got about 6 weeks to research and find out what you qualify for and what benefits you need so that you can sign up for something.
You remember Pearl Harbor Day. How can people find out more about their options and including new People's Health plans?
Yeah, we're hosting a mix of virtual and in-person events all the way through mid-November before Thanksgiving. The in-person events, by the way, are going to be hosted in a safe, socially distant, and combination of one-on-one meetings and small groups. Reservations are required because we have to limit space on those. But people can actually find out when all those are, what's close to them by going to peopleshealth.com/meetings, and we can let you know where and when you can talk to somebody about these plans.
What is the age for this? Somebody texted that in, and I don't know if we've covered that or not. When do you become eligible for Medicare?
Medicare, yeah. So at age 65, but some people with disabilities can actually be eligible before age 65. So definitely you want to reach out and talk to us so you can find out if you might be eligible for one of those plans.
And how does that play out with birthdays and so forth? Like, because actually, obviously not everybody's going to turn 65 within the enrollment period. I know that's a dumb question, but that's what I do, Doc.
No, it's a good question. You can actually once you have your 65th birthday coming up, you can actually enroll a couple of months before your birthday, and then you can actually enroll about a month after your birthday as well. So we do have something called rolling enrollment that doesn't necessarily require this time period that we're in now. This is really when a lot of people can change plans. So if they're not happy with some of the benefits that they have, then this gives them a chance to shop around and get the plan that's best for them.
So it's 855-821-2666. And can they get that information on the People's Health website as well?
They can, yeah. peopleshealth.com/meetings or call us anytime.
Thank you, Dr. B. Get out and enjoy this beautiful weather this weekend.
Thanks, Tommy. I will. You too. Thanks, Tommy. I will.